Welcome back. In this video, we'll talk about the diagnosis and signs and symptoms of schizophrenia. The first group of symptoms of schizophrenia is known as the positive symptoms. And positive means that these patients have some symptoms that normal people don't have. To understand this better, the second category is called a negative symptom, which means that they have less features of something that everyone has. So for example, a negative symptom is decreased emotions. Everybody has emotions, but when it's decreased, it is called a negative symptom. On the other hand, positive symptoms include hallucinations. This is an abnormal sensation that the general population don't have. So a negative symptom is decreased normal feature, and positive symptom is addition of abnormal feature. And the third category is cognitive symptoms, and these include memory, thinking, and problem solving. The positive symptoms that we have include delusions, and these can take many forms, like delusion of grandeur, where the patient thinks that they're invincible and they can do anything. Or delusion of control, where the patient thinks that somebody else is controlling them. Hallucinations, which simply means that the patient senses something that is not there. And this can also take many forms, like smelling certain smell that is not there, or hearing something or seeing something that is not there. Disorganized speech, disorganized behavior, and catatonia, which is abnormal flexion or rigidity of the body. The negative symptoms include decreased emotions, decreased interests, flat affect, which means that the patient has minimal emotional response to the world around them, alogia, in which the patient responds with one or two words, trying to keep the speech to minimum, and avulsion, which is decrease in motivation. The cognitive symptoms include decrease in memory, decrease the learning capacity, and difficulty understanding simple topics. To correctly make the diagnosis of schizophrenia, we first have to rule out any medical or drug-related causes. So the patient has to have the symptoms that we will mention, but they also have to be cleared of any medical causes, like Cushing syndrome, for example. And the symptoms has to last for at least 6 months. To make the diagnosis, delusions, hallucinations, disorganized speech, disorganized behavior or catatonia, and negative symptoms. But at least one has to be one of the three. And that's simply the symptoms and diagnosis of schizophrenia. Thank you so much for watching.